Hi, I'm Fiona. Welcome to Caithness Movement Therapy. This video explores our wrists, hands and fingers. It's a somatic movement flow from gentle somatic yoga, and it's really helpful if you have any hand or wrist stiffness or pain. Great for carpal tunnel, great for arthritis. Really gentle way of exploring your hand movements and using pandiculation to help repattern the nervous system, release muscle tension and take some pressure off the joints. There's lots of reasons our hands become stiff and sore. A lot of it, I think, is because in our life we use our hands in flexion, so they get used in that direction, and not in extension. They don't get opened up very often. So we tend to lose mobility. The muscles at the front of the hand, in the palm and in the fingers, become contracted because they're working all the time, and there's no balancing movements to open up and balance the extensors and the flexors and take pressure off the joints. Lots of joints within the wrist and then in the fingers themselves, and they can become sore and inflamed, and this is a really nice way to actually help relieve them. So you'll want a cushion that you can rest either on a table or your lap so that you can set up position. I'm going to demonstrate one hand only, as this is quite a long flow. It's worth putting the time into, but if you follow along with one hand and then basically re-watch it and just practice with the other hand instead. So taking your cushion or your bolster, you can either have it on a table like I have, or you could rest it on your lap, but just make sure it's high enough that the forearm is supported and you're not bending forward to the hand, so you're becoming tight through the shoulders. You want to be nice and open and relaxed through your neck and shoulders and able to just completely relax your hand when you want to. Okay, so as I say, we're going to use assisted pandiculation for this, and that's where you use your own touch and pressure of your body to actually enhance the feedback from the pandiculation. So remember, pandiculation is that 3 parts: controlled contraction, smooth release, and complete relaxation. Please no pain or strain at any point. Hands can be very delicate, can be very sore, so only use as much effort as you're comfortable with. Make sure that your hand is feeling comfortable at all times, and if there is a movement that you're particularly not liking, then either leave it out or just visualize it. You can imagine that your hand is making those movements and you will still have benefit. Okay, so once you've got everything set up, we then need to find out where we're at before we get started. So just take your attention from your elbow down through the forearm and into your hand and your fingers. Don't forget the thumb. Just notice what you feel. Is it comfortable? Is it tight? If you have something like carpal tunnel, you might be aware of pins and needles, tingling or pain all the time. And if that's the case, then you just have to really be gentle with your body. Notice if something starts to make your symptoms feel worse, just back off the movement, do it more gently or visualize it. Okay. And then on top of your scan, once you know how things feel, start to introduce a little bit of movement, a little bit of piano fingers, a little bit of flexion and extension and rotation of the wrist. Just notice, what does that feel like? Is it comfortable? Is it pleasant to move? Or not so much? Is there one particular finger that feels more noticeably stiff or sore than the others? Just have a play. Notice what you feel. Okay. And then let's get into our pandiculation. So allowing your forearm to be supported on your cushion and your hand to be completely relaxed. We're going to start with resisted flexion of the wrist. Now, flexion is bringing your hand in that direction. So to start with, we're going to bring the wrist into extension, which means you're going to bring the back of the hand up towards you. Okay, nice and relaxed through the hand, only as far as you comfortably can without any sense of strain. There'll be a natural stopping point. Okay, then you're going to take the fingers of the other hand, place them on the back of the hand that you're working with. Create a balance so that this hand is pushing back towards the table, this hand is pushing back towards you from the wrist. Never a fight, never a strain, just a gentle sense of balance. And then let the top hand start to exert a little bit more pressure so that it brings that hand down towards the table. Just moving through the wrist, finding that end range of movement where your body says, that's where I want to stop, and then let the hand completely relax. We're going to do this twice more. So extension, make your load, and then let that top hand start to flex the wrist, but keeping the effort there, so you can still feel effort in your forearm, and then let it go. And then one last time. When you get used to this, you can play with the angle you bring the hand back at and just use it in different positions. But for now, just keep it straight and centered. Focus on learning that balance, light touch, and then complete relaxation. What does that feel like now? Are you noticing any sensations through the forearm? Any sensations in the wrist? All feedback for your brain to process and your nervous system to use. Okay, then you're going to turn your hand palm up. Now be careful with this one. We're going to take the wrist into extension. So this is resisted extension. So bringing your hand up towards you. This is a flexed position. Okay. Then again, you're going to take the other hand, place it on top. Find a balance between the two. So this hand is pushing towards you, this hand is pushing to the table, but there's no movement happening, but also no force involved, light balance. And then just let it come towards the table into extension, but it's still wanting to flex. You're still exerting effort in the muscles in the forearm. Find that natural stopping point. Let the hand relax. It might pop back over, that's fine. Just find what your relaxed position is. And then twice more. Bring it up. Exert pressure without movement, and then allow the extension to start. Keeping it comfortable at all times, and then let yourself relax. And then one last time. Bring it into flexion. At the wrist, there'll naturally be some curve of the hand. Just allow that shape to happen. It's all about working with your body in a way that's comfortable and natural, but allowing it to become aware of things that can change and work more optimally. Complete relaxation. Okay, you can either keep your arm there, or if you need to, just take a break, give the shoulders a shake. Make sure you're nice and relaxed still through the chest and the neck and shoulders. And now we're going to move on to some movement with the fingers. Exactly the same as we've done with the wrist, but one finger at a time. If you're short on time, you can do them all together, but you just get a little bit more feedback of each individual finger and its muscle groups if you have the time to do them individually. Okay, so let's start with the index finger. Thumb we leave alone for a moment, that gets its own little shot at fame. So it's lifting the index finger into extension to start with. And then we're going to take it into flexion. So just using two fingers of the other hand so you don't exert too much pressure because these joints are quite delicate. Build your load. So the finger is resisting, coming up towards the ceiling. Try and keep the hand as relaxed as you can. It's quite tricky. And this one is going to gently take it down towards the table. So find your balance and then create movement, but still with resistance. And then relax. Twice more. Engage, build, release, and let it go. One last time. Engage and build, find your balance, controlled release, and then complete relaxation. Next finger, coming up, engage, and then let it release. Fingers become more difficult, and relax. We're not used to moving them all independently. Twice more. Engage and hold, and then release, and relax. One last time, engage. Feel the muscles at the back of the hand and the forearm working. The tendons for these muscles come right up into the forearm, much further than you would think. and then release. Onto our fourth finger, not always much movement there independently. See what you have. My little finger's not behaving. Lift, find the extension, and then release into flexion. Let it go. And again, find a balance, build a load, and release, and relax. Last one. Engage, and release. Let it relax. And then finally your little finger, engage extension. That's often quite easier to move. Find your balance, very gently with this one though, very delicate muscles. And release, resisting, but moving. Let it go and relax. And again, engage, balance, and release, and relax. Last one, engage and hold, and then release, and relax. Okay, so now we're going to repeat the same as we did with the wrist the other way. So this time you turn the hand up, we're going to bring it into flexion, and then we're going to extend it. Again, very gentle, please. It's the muscles in the palm often are very tight, so taking the finger into extension can be quite challenging for the body. So just listen to your feedback. If your body says that's where I want to stop, please do. If you find that you've gone a little bit too far and it's like more of an ouch, make sure next time you don't go as far, you don't exert as much pressure. It's a learning process. Somatics is learning all the time. So just listening to your feedback, learning what you need to do. Okay, index finger coming into flexion. Again, two fingers of the other hand on the top. Build a load so they resist one another, and then allow it against resistance to come into extension, just to where it's comfortable, and then let it go. Okay, twice more. Trying to keep the other fingers out of the way is not always easy, but find whatever works for you. Engage and lengthen and release and relax. Again, you get some movement with the wrist as well. That's quite natural. Just make sure you are feeling something in the fingers, and again, find what works for you. My instructions really for this, as James Knight likes to say when he's teaching gentle somatic yoga, are guidelines. You have to take those instructions and find a way of doing this movement that works for your body. Okay, last time with the index finger. Engage and release and relax. Perfect. Next finger. So middle finger, again, quite tricky to isolate, so have a fidget around on your pillow or your cushion and just notice where you can keep at ease. Try not to let the shoulder pop up. Just noticed mine is. That's handy having a camera, handy being in front of a mirror as well sometimes if you're practicing somatics. Extra awareness, extra information. Okay, central finger, bring it into flexion. Engage and hold, and then take it into extension and release. Twice more. Flex, build, release, and relax. And again, flex and build, release, and relax. And I can feel a sensation coming right up into the forearm there. There's no stress, there's no pressure, but you are still having feedback. So notice these little things, these little awarenesses that are building in your nervous system. Okay, fourth finger. Flex, engage, release, and relax. Two more. Engage, let it go, but keep resisting, and relax. And again, engage, release, and relax. And then your last one, the little finger, again being careful, it's quite a delicate digit, so bring it into flexion, a little bit of pressure, find that sensation where those muscles are working, allow it to lengthen and extend and release. And again, flex, resist, release, and relax. One last time. Flex. Put pressure on. Let it release and lengthen. And then let it go. Just give your hand a movement. Just notice what you feel in your fingers. Is there any changes that you're noticing already? Okay, thumb. Thumbs tend to get very tight through what we call the thenar eminence here. So this is a really nice way of releasing that. So you're going to use the 4 fingers on the other hand. You're going to tuck them into that crease that you can see across my hand there. You're going to bring the thumb and the little finger together or towards one another. They won't necessarily meet. And then you're going to keep that resistance of the thumb trying to become towards the little finger, but the 4 fingers of this hand are going to open the hand to an outstretched palm. So these muscles are working in contraction, and as they're working in contraction, you're going to ask them to lengthen. Again, no force involved, all gentle balance. So thumb to finger, tuck your hand in, and then gently create an open palm and relax. Twice more. Engage, find a balance, but then this hand just says no. You're going to lengthen and then release. Last time. Coming in, bring it to an open palm, and then let your hand completely relax. And now it's time for some TLC for that hand because it's worked hard. So we're going to work with each digit. You're going to wrap the other hand around the digit, put gentle pressure in towards the hand. We're not pulling away, we're pushing towards, and then just gently rotate through the joints. Same with each of these fingers. And you can do this for as long as you want. It's quite a nice sensation. For time purposes, I'm going to keep it fairly brief. Okay, index finger. Again, pressure comes towards the hand and the arm, taking tension away from the finger by using compression. Fascia functions under tension. Remember that soft tissue that connects everything. So if you compress, you change feedback, you change the way it works. And right down to a cellular level, you can create a response and a change in the way it feels. And last little finger wrapping around. Make sure you can see. Give it a little wobble. And then our last thing is we're going to bring the hand into passive flexion. So letting the hand you've worked with completely relax. You're going to bring the other hand around, tuck it in, tuck the thumb in as well if you can. So it's coming into flexion, that closed position in a soft fist, making no effort of its own at all. Your other hand is doing all the work. And this is quite a nice time to add a little bit of gratitude to your body in, and a sense of loving care perhaps towards yourself. Our bodies work hard for us every day, and we quite often moan about how they look, how they feel, what they don't do. And sometimes it's just nice to take a little moment to give them a bit of appreciation. And then let that hand relax. And if you want to, you can also finish off with a little bit of squeezing and rubbing of the forearm, coming right into from the wrist to the elbow. Just gentle touch. Doesn't need to be deep and painful. Just engaging your own awareness with what you feel in those tissues. And then coming back to those movements that we performed at the beginning when you were assessing how you felt. Remember flexion and extension of the wrist, rotations, piano fingers, maybe a little bit of a soft fist and an open hand. Think about what that felt like before you started. Has that changed? Have the sensations and feedback that you're getting changed in any way? Might be the nature of the movement, the quality, might be the mobility, any number of reactions that you might feel. So as I say, I'm sorry it's a very long flow, but it is worth taking the time to do. And then what you need to do is start the video again and come back to your other hand and do exactly the same. And then when you've finished, if you want to, you can even do a little bit of massaging of them both together, squeezing, and again, a little bit of self-care. So as always, I hope you find that useful, and I will see you very soon. Thank you.